Epilepsy is one of the most common neurological conditions affecting dogs, characterized by temporary, involuntary disturbances in brain function. These disturbances typically manifest as seizures, which involve uncontrollable muscle activity. Seizures can vary in frequency and intensity, occurring as isolated incidents, in clusters, or at regular intervals. At its core, epilepsy involves abnormal electrical activity in the brain, leading to symptoms such as loss of consciousness and convulsions. The causes of epilepsy in dogs can be categorized into several groups: idiopathic, unknown, causes. Often, the cause of epilepsy in dogs is unknown. In many cases, it is thought to be genetic, especially in certain breeds. Symptomatic, occasional causes. These include structural changes or injuries in the brain such as congenital malformations, inflammation, infections, strokes, and tumors. Symptoms of these underlying issues can often lead to seizures. Reactive, interactive causes. These are seizures triggered by external factors such as metabolic disorders or exposure to toxins. Such triggers can affect brain function and provoke seizures. Other medical conditions. Seizures may also result from conditions like liver disease, kidney failure, or brain trauma. Environmental stimuli that cause excitement or agitation can also provoke epileptic episodes. Certain foods and substances are known to trigger seizures in dogs. These include foods containing methylxanthines. Dark chocolate and caffeine are common culprits. High salt content, such as seawater, table salt, and homemade Play-Doh. Xylitol, found in many artificial sweeteners. Other toxic substances, including theobromine, ethanol, and certain mushrooms. Additionally, dogs exposed to substances like ethanol, found in alcoholic beverages, isopropanol, rubbing alcohol, methanol, varnishes and cleaners, ethylene glycol, antifreeze, and various toxic animals, like bufotoads, can develop epilepsy. Dogs can also be affected by lead, found in old paints, carbon monoxide, from fumes, zinc, found in some coins, illegal drugs, such as amphetamines, methamphetamine, cocaine, marijuana, and opium. Medications, including painkillers like aspirin and ibuprofen, antidepressants, theophylline, chlorpheniramine, and antihistamine, cancer medications like 5-fluorouracil, beta blockers, decongestants like ephedrine and pseudoephedrine, muscle relaxants, rodenticides, and weed killers. Dogs with epilepsy can lead fulfilling lives with proper management. About 60 to 70% of epileptic dogs have their seizures well controlled with medication, although 40 to 60% may experience recurrent episodes. The average lifespan of a dog with epilepsy is around 8 years, compared to 11 years for those without the condition. Lifelong treatment is necessary, and balancing quality of life with effective treatment is crucial. Certain breeds are more susceptible to idiopathic epilepsy, including Australian Shepherds, German Shepherds, Beagles, Belgian Tervuren Shepherds. Common signs of a dog experiencing an epileptic seizure include stiffness and muscle tremors, shaking of the body and leg, paddling, drooling, or foaming at the mouth, involuntary defecation or urination, loss of consciousness. Treatment typically begins when a dog has more than one seizure per month, or if seizures are severe and prolonged. Medications like phenobarbital and potassium bromide are commonly prescribed to manage seizures.